Hi, do you suffer from constipation, diarrhea, or a mixture of both? Have you been told you have irritable bowel syndrome? Well, then this video is for you. I'm Dr. Karin Drummond, owner of Drummond Chiropractic, and I'm going to share with you a simple health tip to help with irritable bowel syndrome. But before you follow any advice from any video, check with your healthcare provider to make sure it's appropriate for your specific condition. If you like this video, please let us know by clicking the like button below. And if you think this is helpful for someone else you know, please share it with them. And if you want to see more content, please don't forget to subscribe. So what's my simple health hack if you have irritable bowel syndrome? It's psyllium fiber. And you might be thinking, well, I can see how fiber could be helpful for constipation, but what about for diarrhea or a mixture of both? Well, psyllium fiber is what's called soluble fiber. There are two kinds of fiber. There's the insoluble and the soluble. Insoluble fiber is the more kind of like rough fiber that can tear through your system. So if you have constipation, it might be too much for your system to handle, and it might lead to diarrhea, and then when it wears off, you might be constipated again, and it can lead to a mixture of both. But soluble fiber is kind of like brushing your hair with a nice brush instead of a thick comb. So the comb would be like the insoluble fiber, and a brush is like the soluble fiber. It gently cleanses the colon. So soluble fiber is gelatinous, kind of like a sponge. It soaks up fluid. So when you take soluble fiber, it will sponge up the extra liquid, making the stools easier to control. And if you have constipation, it makes it more spongy, so it's easier to pass. So can you see how psyllium fiber can help both constipation and diarrhea? The problem is when you add it to water, it's kind of like a jelly, making it difficult to drink. So what I do is I add it to oatmeal. I take 1/3 cup of oatmeal, cook it in a cup of water, and I add a teaspoon of psyllium fiber, which will make it kind of gel up, and you can add honey or berries to taste. But I wouldn't use maple syrup if you have diarrhea, because it can lead to more diarrhea. And if you use maple syrup, make sure it's the real maple syrup, because a lot of maple syrup has corn syrup added to it as a filler, and that can irritate the bowels. Normally I advise my patients to eat the oatmeal psyllium blend every morning until their bowels normalize, and then try eating it just every other day, and then every second day, and then every third day. But when you get to every fourth day, I say keep it there until we get to the root cause of the irritable bowel, because if you go too long, you don't want to end up getting symptoms again. I can't stress enough, find a healthcare provider that will get to the root cause of your irritable bowel, not just dealing with the symptom of it, so you don't have to keep suffering. I hope this has been helpful, and until next time, stay well.